will be in attendance at the president's health care summit tomorrow. Congressman, am I too cynical to look at tomorrow's event as basically a puppet show?
Well, you know, I hope not, Dylan. I think we have an obligation to go there in good faith and try to present ideas, and I hope to do that. And obviously, one of the things I'm going to try to talk about is getting the costs out of health care, which the bills that have passed the House and Senate, the Democrats have supported, don't seem to do. Yeah. And also discuss other ideas there. And so, yeah, I think we're going to try to make it real. But it does sort of temper expectations when the president releases a plan on Monday, and we keep hearing talks about what they're going to shove through their bill on reconciliation, and they're meeting behind closed doors, and they have it all done. So it's hard to know what's going to happen, but I think we have to try and do our best.
Here's the problem, right? One plan, the Democrats' plan, provides the universal coverage. They'll spend whatever money. They got the printing presses going in D.C. anyway, and quite honestly, they're fairly old. They're not going to live that long. These are bills for people who are going to be alive long after they're gone. On the Republican side, it appears the cost concern is very real, but there's not an acknowledgement of the incredible harm that is done to a huge percentage of our population because they have no access or can't afford the health care. Now, it'd be one thing if we didn't have a rigged game and it was, listen, we can't make it any more efficient, but it's obvious that that's not the case, and it's obvious that there are better ways to do it. We've seen both proposals from Ron Wyden and Wyden-Bennett on the Democrat side, although that was a bipartisan bill, and from Paul Ryan on your side that would empower the tax subsidy to the patient, that would create all the things. I'll go on all day about it, and yet neither the Republican plan nor the Democrats' plan accomplishes any of those things, which is frustrating for people when you see that there are those ideas in Washington, just no one seems to want to do it.
Well, I think what the American people are saying is they don't want one of these big bills that changes everything and reworks the whole system. What they want to see us do is start on a path to comprehensive health care reform and take a step-by-step common sense approach. We do that by bringing costs down. Right. We insure millions more people than are, and frankly, their insurance numbers go up because they increase Medicaid so substantially. We can't afford to increase that entitlement, both from a taxpayer standpoint, and the states can't share that cost.
But there's a lot that we can't afford. But 2 points for you. One, if you ask people what they actually want, and if you believe in polling, which again, I'm not saying that's the end-all be-all, but if you ask people what they actually want, the Reuters poll, I got thousands of polls that'll show this, about 60% just want the public option and competition for the health insurance companies, but nobody in D.C. obviously seems to be into that because that's not very good for any of the special interests. At the same time, the cost issue, when you bring it up, it's expensive because you have a system that was built in 1942 as an employer-based system that completely detaches the patients and doctors from the cost of their health care and makes it easy for the insurance companies to let it spiral out of control. And yet no one wants to reform that either. So how are we supposed to take any politician seriously when they're not dealing with the underlying structural problem and each one just points fingers at the other? One says it costs too much and the other one says you don't cover anybody, when there are plans that do both and no one wants to talk about them.
Well, I think when you look at some of this polling, which you've obviously done, and you look at support for the public option, it obviously goes in reverse when you say, well, you're going to have to pay more, or it may limit your choices, or it may have all of these other things that public options around the world have done. It's no mistake that the premier of Newfoundland in Canada comes to the U.S. for his heart surgery because he said, I didn't want to wait in line and I wanted an experienced doctor. So
and if you're,
I think you have to look at
stinking rich and powerful, like for somebody like me, I wouldn't go anywhere else because basically if you're rich, you can get whatever you want. But the problem is it's a rigged game in which 46 million people are currently deprived any coverage and nearly 100 million people are deprived basic primary coverage, which forces them into the most expensive medical care system we have, which is the ER. I mean,
we have to reform. We need to reform health care. We need to do that. But I think what would happen and what could work is if we could address some of these things to reduce costs. I mean, why isn't lawsuit reform of the kind that Texas and California have passed? We've seen 600 doctors move to Texas because of those changes. Yeah. If we could adopt those, we could save $54 billion in the federal side and the government side of health care.
Just so you know, $54 billion is pennies. I know people love it. It's even the $68 billion in the Republican plan. That's 17 pieces of paper on my stack of hundreds of pieces of paper yesterday. The cost savings and tort reform, I think, amounts to 1/2 of 1%, or legal amounts to 1/2 of 1% of the total medical expenditure. No one wants to cut the real meat on the bone. which
let me
is
just finish.
the
You're only
employer-based
looking
system
at
and the
the government
insurance
side,
monopoly.
which is $54 billion. We'd actually save, according to experts, $239 billion in the private sector if we could adopt lawsuit reform, because CBO only scores the government dollars, but there's tremendous savings that we'd get. It's much larger than the 54. It's well over $250 billion.
I get it. I just
That's
don't. I get all that. I love. There's a million ideas. We know the problem. No one wants to deal with it. Insurance monopolies, employer-based system, bankrupting America. The Democrats want to print money to pay for it. The Republicans want to not cover more people
Want
and
to
allow
lower
it.
cost, increase coverage.
Yeah, but nobody's reduced cost, increased coverage. You have to deal with the elephant in the room, which is a system from 42, and you and I both know that ultimately.
Well,
Listen,
we do need to have the entitlement reform in terms of Medicare and Medicaid. I don't think that's the right thing to do in this bill. I think one of the mistakes they've made is they're trying to do too much. They're trying to do a long-term care. They're trying to do Medicare changes. They're trying to reform Medicaid. That can't all be done in one bill. I think you need to take a step-by-step approach. Start with this, get the victories we can, and then move forward.
I agree. What's interesting to me is that you can have a few thousand-page bill and not actually deal with the structural problem. Congressman, a pleasure. Ezra Klein.
Thanks a lot, Dylan.
Thank you, Congressman. Ezra, you know I drive a tough bargain on this one, but I got the money, I've got my puppets, and I've got my babies. Am I being